Torn patellar tendon. Causes, symptoms, and treatment. A torn patellar tendon is a serious knee injury that can significantly affect mobility and daily function. The patellar tendon plays a critical role in the knee's extensor mechanism, allowing the leg to straighten during activities such as walking, running, and climbing stairs. When this tendon is partially or completely torn, patients may lose the ability to actively extend the knee, making even simple movements difficult. Early diagnosis and appropriate treatment are essential to restore function and prevent long-term complications. According to the American Academy of Orthopedic Surgeons, patellar tendon injuries are commonly seen in active individuals and athletes, particularly during high-impact activities. What is the patellar tendon? The patellar tendon is a strong band of fibrous tissue that connects the patella, kneecap, to the tibia, shin bone. It works together with the quadriceps muscle and tendon to enable knee extension, which is essential for standing, walking, and jumping. What is a patellar tendon tear? A patellar tendon tear occurs when the tendon is overstretched or ruptured, either partially or completely. Types of tears. Partial tear. Some fibers are damaged, but the tendon remains intact. Complete tear. The tendon is fully ruptured, often leading to loss of knee extension. Complete tears are more severe and usually require surgical repair. Causes of patellar tendon tears. This injury typically results from sudden force or chronic stress on the tendon. Common causes: sudden jumping or landing movements, direct trauma to the knee, rapid change in direction during sports, chronic overuse leading to tendon degeneration, tendinopathy. Risk factors include previous tendon injuries, chronic diseases such as diabetes or kidney disease, use of corticosteroid injections, poor conditioning or muscle imbalance. Symptoms of a torn patellar tendon. Symptoms vary depending on the severity of the tear, but commonly include 1. Sudden knee pain, sharp pain at the front of the knee during injury. 2. A popping sensation. Many patients report hearing or feeling a pop. 3. Swelling and bruising, rapid swelling around the knee joint. 4. Inability to straighten the knee, difficulty or inability to extend the leg actively. 5. Difficulty walking, instability or inability to bear weight. 6. Visible deformity. The kneecap may appear higher than normal in complete tears. These symptoms require immediate medical evaluation. Diagnosis. Accurate diagnosis is essential for proper treatment. Clinical examination. A physician evaluates ability to extend the knee, position of the patella, swelling and tenderness. Imaging studies. X-rays may show a high-riding patella, patella alta. MRI confirms the extent and location of the tear. MRI is the most reliable method for assessing soft tissue injuries. Treatment options. Treatment depends on whether the tear is partial or complete. 1. Non-surgical treatment. Indicated mainly for partial tears with preserved knee function. Includes knee immobilization with a brace, rest and activity modification, ice and anti-inflammatory medications, physical therapy to restore strength and flexibility. 2. Surgical treatment. Complete tears typically require surgery to restore knee function. Surgical procedure. The torn tendon is reattached to the patella. Sutures or anchors are used to secure the tendon. Surgery is ideally performed early for better outcomes. According to the Mayo Clinic, early surgical repair significantly improves recovery and functional results. Rehabilitation and recovery. Recovery after a patellar tendon injury requires a structured rehabilitation program. Early phase. Immobilization to protect the repair. Gradual weight-bearing as advised. Intermediate phase. Range of motion exercises, muscle strengthening, quadriceps focus. Advanced phase, functional training, return to sports activities. Full recovery may take 4 to 6 months or longer, depending on injury severity and patient compliance. Complications. Potential complications include knee stiffness, weakness of the quadriceps muscle, re-rupture of the tendon, infection, rare in surgical cases. Proper rehabilitation helps minimize these risks. Prevention strategies. While not all injuries are preventable, risk can be reduced by strengthening the quadriceps and hamstrings, avoiding sudden increases in activity intensity, using proper technique during sports, and treating tendon pain early before it worsens. When to see a doctor. Seek immediate medical attention if you experience sudden knee pain with a popping sensation, inability to straighten the knee, difficulty walking or bearing weight, significant swelling after injury. Early diagnosis improves treatment success and recovery outcomes.